Hello, everyone. Welcome back, Dr. Ibe. Once again, your platform medical advisor. I find it necessary to talk a bit more on this COVID 19 coronavirus, even though it's on a decline. However, in some areas, it is still in the increase. So it is still out there, it is still highly contagious. I've mentioned previously that we shouldn't in no way lower our guards. However, I've had queries on the symptoms of COVID and when they should go to the hospital, how is he treated. Now, in the past as well, we had talked about this robustly that the only way to know if you have this COVID or not is to get tested. The fact that you don't have symptoms does not mean that you don't have COVID. So you need to get tested to find out or not. And if you have mild symptoms, like sore throat, mild ache in the body, loss of sense of smell or thirst, you don't have to be admitted. However, you need to be isolated for 2 weeks, and contact tracing is highly essential. Those who've been in contact with you need to be tested. Okay, they need to be traced and tested. And we get very worried if you have this COVID with other underlying health conditions. And, it could be cancers, chemotherapy, diabetes, breathing problems. They were there before you have the COVID. Then we get very concerned. And talking about underlying conditions, please bear in mind that obesity is now regarded as a serious underlying health conditions, which can be very dramatic, and the outcome of COVID-19 may be fatal if you're obese. Okay, so obesity is now regarded as a serious underlying condition. And I had mentioned as well that when it comes to treatment, there are evidences to support that some patients in the UK who were in the hospital on oxygen and some even on ventilator, they were given dexamethasone, and some of them got better. The outcomes were very beneficial and encouraging indeed. I had equally mentioned that I had a case where someone was very unwell. I spoke to this person over the phone, couldn't talk, difficulty in breathing. I sent him for investigations. The x-ray, the chest x-ray showed a classical COVID-19 type of pneumonia. He didn't go to the hospital. All I did was to prescribe strong antibiotics and a steroid on the class of dexamethasone, and this person felt better. He's out and about now, and he's gone back to work, obviously after 2 weeks in isolation. I won't tell the name of the antibiotics or steroid. However, this happened to me. It is real. So the person got better. Okay, I've equally had queries where people are asking me, drinking ginger, garlic, or herbs do help to treat the COVID. And my response to that was no. There is no evidence to support that these herbs, ginger, garlics, do treat COVID-19 or coronavirus. However, fruits, vegetables, herbs, garlics, gingers are beneficial anyway. Some of them help to lower the blood pressure. Some of them help to cleanse the system. Some of them help to purify the blood. And indeed, some of them help to boost the immune system. It doesn't mean that they treat COVID-19. So yes, all these herbs, gingers, and garlics do not treat COVID-19, but they can be beneficial. Okay, so to recap, once again, these talk is based on the queries I've had from people. The only way to find out if you have COVID is to get tested. You may be symptomless. You may have mild symptoms, mild flu-like symptoms, the symptoms may be worse depending on other underlying health conditions. Okay, in that case, if you are too unwell, cannot breathe, high temperature, very, very lethargic, tired indeed, you may have to be in the hospital where you are looked after. Please, once again, this advice shouldn't in no way substitute your healthcare provider, your doctor or your nurse. At all times, at all cases, when possible, contact them, please. There are webinar consultations, video consultations, and phone calls. Please contact them at all times. Once again, take care of yourselves. Be safe, play safe, and be good. God bless. Bye.